Okay, hello everyone. In this good opportunity, we are from SGDB10. We want to present about our study project with a title Initiating the Awareness of Diabetes Mellitus Type 2 in Tourism Health, a brief education for travel guide and driver. And in this section, there's a list of our member of the SGDB channels.
Hello, my name is Dewa Angelica Utami with my last digit of my name is 098. So I'll explain about the background why we create this student project. Traveling today has become a common thing for humans to do today. Tourists certainly feel unfamiliar with the area they visit. They usually have problems with the food, climate, time change, and environmental condition. This change is especially felt by tourists who have certain diseases such as diabetes. Diabetes is a disease of glucose level in the body that are too high. The highest cases of diabetes are currently held by type 2 diabetes mellitus, which is about 90% of all diabetes causes worldwide. Type 2 diabetes mellitus is caused by lifestyle factors that cause insulin resistance. Tourists who have type 2 diabetes should certainly be concerned because of the food, environmental factor, and time that are unfamiliar to them. This is a special concern, especially for travel guides and drivers to find out the condition of the tourists. So that's all for me. Thank you.
Thank you so much for the opportunity. First of all, let me introduce myself. My name is Rahel Juliana Manurung with the three last digits of my student ID 030. So in this presentation, I will explain about our problem foundation, purpose, and also benefits of our student project. So the first one is problem foundation. What is the definitions and diagnosis of diabetes mellitus type 2? And how is the epidemiology of diabetes mellitus type 2 in a tourism country? What are the signs and symptoms of diabetes mellitus type 2 in traveling? What are the risk factors of diabetes mellitus type 2 in traveling? And how is the prevention of diabetes mellitus type 2? And what is the definitions and scope of tourism health? What are the problems of diabetes mellitus type 2 in travelers in tourism health? And what are the lifestyle and therapeutical concern of diabetes mellitus type 2 in travelers? And what are the travel guides and drivers' educations in managing diabetes mellitus type 2 emergency? And how to build role models and healthy habits for traveler guides and drivers. Next is about the purpose, including the general purpose and the specific purpose. For the general purpose is to provide information on how to initiate the awareness of diabetes mellitus type 2 in tourism health by giving a brief education for travel guide and driver. And also for the specific purpose is to give the understanding of the definitions and diagnosis of diabetes mellitus type 2, explaining the epidemiology of diabetes mellitus type 2 in tourism country, understanding the signs and symptoms of diabetes mellitus type 2 in traveling, understanding the risk factors of diabetes mellitus type 2 in traveling, explaining the preventions of diabetes mellitus type 2, and understanding the definitions and scope of tourism health, understanding the problems of diabetes mellitus type 2 travelers and tourism health, understanding the lifestyles and therapeutical concern of diabetes mellitus type 2 travelers, understanding the travel guides and drivers' educations in managing diabetes mellitus type 2 emergency. And the last one is explaining building role models and healthy habits for traveler, guides, and drivers. And the last part is about the benefits of our student project, is to enhance knowledge about initiating the awareness of diabetes mellitus type 2 in tourism health by giving a brief education for travel guide and driver. And also, the student project will help the undergraduate students learn more about the clinical skills needed to become medical professionals, and we hope the student project will contribute to the science of the future. That's all for me. Thank you.
Hello, my name is Lyshanda Bianca Kusuma with the last digits of student ID is 025. Now I will explain about definition and diagnosis of diabetes mellitus type 2. Diabetes mellitus type 2 is a chronic metabolic disorder characterized by insulin resistance and relative insulin deficiency, resulting in elevated blood sugar levels. Diabetes mellitus type 2 is strongly associated with lifestyle factors such as obesity, poor diet, and physical inactivity. Next slide. Diagnosis of diabetes mellitus type 2. Diagnosing patient with type 2 diabetes is a two-step process. The first step is to confirm diagnosis of diabetes, and there are four criteria for diagnosing diabetes mellitus. The 4 criteria have been listed in the table. And the second step is to confirm that the patient has type 2 diabetes. Healthcare providers may consider the historical, clinical presentation, and laboratory findings such as pancreatic autoantibodies and C-peptide levels. Thank you, and next slide.
Okay, thank you for the overview. My name is Valentino Wijaya, which related only numbers 116, and I will explain about the epidemiology of diabetes type 2 in the tourism country. So, almost every country in this world has a cases of diabetes, including the tourism destination countries, such as the following countries, which are popular as the tourist destination. First is United States with 32 million cases, and then Mexico that have 14 million cases, and then France, Spain, Italy with 4 until 5 million cases, and then France, Austria, and Switzerland with under 700,000 cases, and then China with 140 million cases, and then Indonesia with 19 million cases, Japan with the 11 million cases, and Korea and Thailand with 3 until 5 million cases. So the difference of the number of the cases is caused by the many factors. One of them is the food, which is closely related to the tourism. In Asia, most of the food consists high of carbohydrates. And also in the United States, there are a lot of ultra-processed food that can induce the diabetes mellitus type 2. And in Europe, especially in the Mediterranean region, there are a lot of food that in the form of the whole grain, vegetable, seafood, nuts, and olive oil, that making the cases of diabetes in Europe is more likely less than the other area. Therefore, knowledge about the food is also very important to know so that it can improve the quality of tourism health. Thank you.
Hello, my name is Nadya and the last digits of my student number are 155. So on a daily basis, diabetes patient may also experience various unpleasant symptoms because of their diseases. And this could be worsened while traveling. So here are some of the signs and symptoms of diabetes type 2. So some of them are frequent urination, constant thirst, persistent fatigue, unexplained weight loss, itching around the genital area, slow healing of the cuts or wounds, and also some blurred visions. And the diabetes type 2 could also be worsened in some people with some special criteria. Some of them are being over 40 years old or maybe 25 years old for the people who are Asian, Black African, or Black Caribbean race. And then also if they have a family history of having diabetes, and also if they live an unhealthy lifestyle with insufficient physical activity, overweight, and being obese.
Thank you for the opportunity. My name is Putri, and my last 3 digit of my student number is 067. And today I'm going to tell about the risk factors of the type 2 diabetes mellitus in traveling. First one is food intake. 36.7% of the passengers with type 2 diabetes mellitus confirm or show consuming more meals. The pathological process that can happen of this phenomena are oxidative stress, vascular dysfunction, and also can alter the insulin sensitivity and glucose homeostasis. Moreover, if the passenger is consuming more of the alkaline nutritions, and the lower of vitamin D intake can also affect it of the high risk of this disease. Second one is activity level. The increase of activity level shows that has the lower incidence of the type 2 diabetes mellitus, and this activity level associated with the increase or probably lowering the HbA1c in human body. The inconsistent consuming medication. We can say that probably the travelers forget to take their medication as prescribed and also did not do the pre-travel consultation. The non-adherence of the diabetes treatment can affect of the glycemic control, increase of mortality, morbidity, or probably the problem or complications because of the progression of the diabetes. And the last one is environment factors. probably we can go to the areas that has the extreme climate change, or probably after happens the natural disaster. This can affect of how we store the insulin, because unopened vials or the package of human insulin, also cartridge insulin pen, has to be stored at a temperature between 2 degrees Celsius and 8 degrees Celsius. So probably it can affect of how we store our insulin. That's all from me. Thank you.
Good morning, doctor. Good morning, everyone. My name is Kadek Asri Bintari, with the last three digits of my student number are 063. Today, I would like to explain about the prevention of diabetes mellitus type 2. In terms of prevention, type 2 diabetes mellitus can be prevented pharmacologically and non-pharmacologically. The first one is non-pharmacologically. Type 2 diabetes mellitus can be prevented by lifestyle modifications, such as changing our diet to plant-based and increasing our physical activity. Meanwhile, pharmacologically, metformin is the agent with the strongest evidence base and shows long-term safety as a pharmacological therapy to prevent diabetes. Metformin and intensive lifestyle modifications can reduce the risk of diabetes by up to 50%. Okay, that's all from me. Thank you.
Hello, my name is Laura Natasha Putri, with the last digit of my student number 083. Now I'll explain about the definition and scope of tourism health. Tourism health is defined as a branch of public health science, which examines various aspects of tourist health and public health with the main goal to create healthy tourism. There are four scopes of tourism health. The first one is integrated policies, which includes maintain infrastructure and supporting factors such as sanitation, health and safety in tourist destination areas, screening at points of entry or arrival on air, sea, and land travel, as well as involvement of the tourism industry to promote tourism health and safety. The second one is efforts to maintain public health in tourism areas, which includes health promotion in tourist areas, epidemiological surveillance of tourism-related diseases, increasing capacity for disease detection, increasing capacity of health services, local food safety, environmental health in tourist areas, occupational health and safety in the tourism industry. The third one is sanitation of tourism health services, which includes minimum service type standards, human resource standards, health facility standards, and information systems. And the fourth one is health and safety risk assessment and control, which includes identification of potential hazards in each tourist area, risk assessment in each tourist area, developing efforts to control potential hazards and risks, as well as continuous monitoring and evaluation. That's all from me. The next material will be brought by my friend. Thank you.
In this section, we will talk about the problems of diabetes mellitus type 2 travelers in tourism health. Before that, let me introduce myself. My name is G Mahapraja Divasta with my three last ID numbers 0 to H. So there's two main conditions in the traveling. The first one is cold weather and the second one is hot weather. In the cold weather, we need to pay attention on increasing HbA1c levels. We need to pay attention to insulin denaturation due to lower temperature condition, and also the decreased blood flow due to cutaneous vasoconstriction that can induce insulin resistance. Other than that, in the hot weather, we need to pay attention on the dehydration condition of the patient, also sunburn inflammation that can faster insulin absorption. This condition can then lead into the insulin resistant condition. So here in the high altitude condition, we need to pay attention on the two main challenges. The first one is the misreading of blood sugar monitoring device, because the environment in the high altitude can affect that, and also the instability of the diabetes therapy drugs that can affect the effectivity of the drugs. So here's the different method of the traveling, like travel by foot, by sea, by driving, and by air. So if you travel by foot, you need to pay attention on the abnormalities on the foot, like bunions, scallops, ulcer, neuropathy, wounds, and deformities. And if you travel by sea, you need to pay attention on the food selection and seasickness. And if you travel by road, you need to pay attention on the hypoglycemia condition, because it can lead into the cognitive impairment and also can lead into the accident in the road. And if you travel by air, this is the most dynamic condition. You need to pay attention on the insulin administration schedule, pay attention to your diet, pay attention to your cabin pressure change, and also there's a condition called time zone change that can affect in your drugs administration or your condition. Maybe that's all for me. Thank you.
Hello, my name is Ananta Wismaya with last read number of 198, and now I'm going to explain about lifestyle and therapeutic concern of diabetes mellitus type 2 in travelers. Travelers with type 2 face concern that require careful planning, especially when there is a change in routine, diet, and activity. Some of the concern include therapeutic concern and lifestyle concern. First is therapeutic concern. While individual with type 2 diabetes needs to receive education, undergo health check, and discuss potential issues that may arise during their trip. Medication management is also a significant concern, as adhering to the medication schedule is important. Not only that, travelers must ensure access to medication like insulin and maintain proper storage condition. It is also important to monitor blood glucose and adjust insulin doses, which must be discussed during a pre-travel checkup. Next is lifestyle concern. Adjusting to different time zones can disrupt medication schedule and eating patterns, so travelers should plan for these changes. And dietary changes are also a big concern. Travelers should plan their meals to ensure they consume balanced meals that align with their dietary needs. Staying hydrated is also an important aspect, as dehydration can affect blood glucose levels. Travelers with diabetes should also be mindful of changes in activity levels, as increased or decreased activity can impact blood glucose. And in case of a medical emergency, carrying a fast-acting carbohydrate uh, is also really important in case of hypoglycemia, and it is also important to ensure adequate travel insurance that cover diabetes related medical needs. Maybe that's all from me. Next.
Hello everyone, my name is Cendrawan Han Santoso with the last three digits to the number 170. I would like to discuss about travelers, guides, and drivers education in managing diabetes mellitus type 2 emergency. Diabetes mellitus type 2 emergency are divided into three types, which is diabetic ketoacidosis, hyperglycemic hyperosmolar state, and hypoglycemia. In diabetic ketoacidosis, it's hyperglycemia of 250 milligrams per deciliter, metabolic acidosis in which pH is lower than 7.35, high anion gap, and ketonuria or heavy ketonuria. In hyperglycemic hyperosmolar state, there's a marked hyperglycemia in which it's higher than 600 milligrams per deciliter, hyperosmolarity in which plasma osmolarity is higher than 320, and dehydration. In hypoglycemia, it is low blood sugar levels, which is lower than 70 milligrams per deciliter, and neurological impairments. So, these are all common types of emergency in type 2 diabetes mellitus. Traveler guides and drivers must be aware of their own condition to make sure they are fit to work without having an emergency condition. Maintaining a healthy lifestyle is one major way. They must also take note of travelers that have type 2 diabetes mellitus and to be prepared in case of emergencies. Management is usually administration of uh, sugar intake and administration of proper insulin and drug dosage. Thank you.
Okay, thank you for the opportunity. First of all, let me introduce myself. My name is Hana Clara Stanadin with 3 last digit number of student ID number is 236. Okay, let me continue. Building role model healthy habits for traveler guides and drivers. Okay, based on the urgency, there are several things that can be done. First, controlling the body weight. By lowering and maintaining HbA1c level in the normal range of under 5.7%, patient can reduce the risk of having diabetes mellitus type 2 and its complication such as diabetic retinopathy. Second, consume healthier food that contains high nutrition and avoid consuming too much of certain types of food such as processed food or food that are often contains artificial ingredient and low in nutritional value. Trans fat food, alcohol, and products that contain high in sugar. Next one is to do more physical activity. Engaging in exercise can enhance the body to regulate blood flows and also improve the sensitivity of insulin and glucose level throughout the body. And lastly, quit smoking. Quitting smoking can reduce the risk of developing diabetes mellitus type 2 by 30 until 40%. Not only quitting smoking can reduce the risk of having diabetes mellitus type 2, but it also could lower the chance of many complications such as cardiovascular diseases and risk of getting cancers. That's it from me. Thank you.
My name is Jile Fitria Ateta Ginting with the last digit number of my student ID 140, and I will be concluding the student project. In conclusion, with traveling becoming a more common activity, tourism health has been a main concern as there is a higher risk among travelers with type 2 diabetes mellitus. And the symptoms can include frequent urination, persistent fatigue, thirsty, and unexplained weight loss. And preventing these can be done with metformin therapy and weight loss. There are several problems with type 2 DM while traveling according to the climate and the mode of travel. For instance, in hot climates, there is a risk of elevated blood glucose level due to dehydration. When traveling by foot, it increases the risk of bunions, callus, and fungus. Emergencies during traveling can include diabetic ketoacidosis, hyperglycemic hyperosmolar state, and hypoglycemia. It is very necessary to educate the travelers to build a healthy habit, which includes controlling body weight, consuming nutritious foods, engaging in physical activity, and quitting smoking. And that is all from the student project. Thank you.
Okay, this is the reference that we use to make this paper. Okay, that's all from us, SGDB 10. Thank you for the opportunity. Thank you and goodbye.